Hello everyone and welcome back. In this video, I'm here to tell you that a Baker Act facility is not appropriate when somebody is detoxing from substances. It could be drugs, it could be prescription medications. And so we had an incident recently where we had a husband who was taken to the hospital. Apparently it had a reaction to some medication. The ER were able to get him stabilized, but then the doctor decided to Baker Act him and said he was a threat to himself. This looked like an intentional overdose, which it clearly wasn't. And they Baker Acted him and sent him off to a behavioral health facility, a Baker Act receiving facility. And now the facility is telling the family, oh, we're just detoxing him. And once he's off, once we've got him detoxed, we'll let him go. And I said to the family, hold on a second, does he have health insurance? And they said, yes. And I said, this is illegal for a couple of reasons. Number one, substance use is specifically excluded under the Baker Act. The Baker Act is designed for people with mental illness, and it defines mental illness in the Baker Act statute. And in that definition, it specifically says, this does not include intoxication or substance use disorders, meaning this is not for people with substance use, right? That's why we have the Marchman Act. Now, the facility could have Marchman Acted him, the hospital could have Marchman Acted him, but to my knowledge, I've only come across one county in all of Florida that will Marchman Act somebody if you get taken to the hospital. As a general rule, it does not happen, and it requires the filing of a separate petition. And again, I'm not going to get into the weeds here about Marchman Act, but long story short is Marchman Act is for primary substance use. Baker Act is for mental illness. And I said to the family, I think this is an illegal detention. And beside the fact, they're even telling you we're detoxing him. What is a Baker Act facility doing detoxing somebody? What does that even mean? You're not licensed to even receive this patient. So how do you even know how to detox them? They should be in a facility that is specifically licensed to detox people off of various substances. And so, look, if you have a loved one who gets Baker Acted and there's some issue with substances, and the facility's like, well, we're detoxing him, or we're detoxing her, or we're dealing with this substance issue. I'm sorry, but your loved one should not be there. This is an illegal detention, but I give families options, and I think that we need to try and get this individual out. The family will decide what they want to do. But if this is happening to you, there's a problem here. The Baker Act is not, first of all, it's not even a treatment statute. It's just, the idea is you get assessed, you stabilize, and they're supposed to let you go. But anyway, I wanted to share that with you because it's not the first time I've heard it. And I appreciate you tuning in. I'd love a thumbs up. And if you could subscribe to the channel, I would be grateful. See you in the next video. Bye-bye.